Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020, number 066. A 9-year-old boy fell off a tree and hit the back of his head. A brief loss of consciousness was observed. The child's condition is satisfactory. He has a headache and vertigo. Skull X-ray scans show a depressed fracture of the occipital bone in the area of the external occipital protuberance. What treatment tactics is indicated for this patient? A. Hemostatic therapy. B. Lumbar puncture to relieve the pressure. C. Surgical intervention. D. Complex conservative treatment. E. Anti-inflammatory therapy. Skull fractures may occur with head injuries. The skull provides good protection for the brain. However, a severe impact or blow can cause the skull to break. It may be accompanied by concussion or other injury to the brain. The brain can be affected directly by damage to the nervous system tissue and bleeding under the skull, that can compress the underlying brain tissue. Types of skull fractures. Simple fracture, a break without damage to the skin. Linear skull fracture, a break resembling a thin line, without splintering, depression, or distortion of bone. Depressed skull fracture, a break, or crushed, portion of skull, with depression of the bone in toward the brain. Compound fracture, a break in, or loss of, skin and splintering of the bone. Diastatic skull fracture, a fracture that occurs along one of the suture lines in the skull. The normal suture lines widen, most often seen in infants. Basilar skull fracture, a break in the bone at the base of the skull. Patients frequently have bruises around their eyes and behind their ears. They may also have cerebrospinal fluid, CSF, draining from their noses or ears. CSF may leak if the dura mater is torn. It is the most serious. The goal of skull fracture treatment is to control pain, promote healing, and prevent complications, including after surgery. Most cases only require close observation in the hospital and medication to relieve pain during the healing process. However, some require surgery. Surgery may be needed to repair compound fractures, comminuted fractures and some types of closed fractures, and also to stitch up any tears in the dura mater and scalp. The answer is C. Surgical intervention.